So yesterday we talked about some types of tests which required to diagnosis about respiratory system diseases. So here some other tests also are procedures, okay, which increase and which give the correct idea regarding respiratory diseases. Like some of those I will mention here. I will go into the detail. Okay. One is CT scan. Okay. CT scan of chest. This is also most common during HRCT, what we will call is high resonance computer tomography, HRCT, in during COVID. Normal CT scan and HR CT scan have some differentiate. It is high resonance scan of chest. CT scan of chest region, you will get all the lungs details. Okay. And some second is uh, MRI. Okay. MRI of chest. This is also give complete detail. This is magnetic resonance imaging. Okay. Of chest. This is the second option we have if you want to go in detail. And we have nuclear medicine. Okay. Nuclear medicine. This is, we can see that this is the uh, thing which uh, you can see the detail and mostly you can diagnosis the cancer, okay, or tumor like substance in the nuclear medicine. Okay, in the complete detail, we will get that. And we have angiography. Pulmonary angiography is there. Means these are the things which mostly advised by the expert doctor, pulmonologist. Okay, pulmonary angiography to see the vessels of lungs, like we have cardiac angiography, like coronary artery angiography. We have the pulmonary angiography. Okay. Next, sometimes we can see ultrasound, USG of chest region also, ultrasound. Okay. And next we have after uh, ultrasound, we have bronchoscopy. Yesterday I also told about that bronchoscopy. Okay. And in the collection of sample, like yesterday I told that we have sputum culture, because we have to know all this, because some patient will come to your clinic by doing all this. Okay. Likewise it will happen. Okay, because all the number of patient come to your clinic not in the beginning. He will come after some time, or uh, he will go to the all the doctors, then he will come to you, he will collect the reports and he will come to you. Okay, then you have to know basic idea of that. Okay. Or else sometimes you have to advise to know the correct physiology and anatomical structural defect which is present in the respiratory system to treat the to have to treat complete treatment. Okay. So here you have to know sputum, and here we have the PNA, PNA, percutaneous needle aspiration. Means they will take the needle. They will take the sample of fluid. Okay, and for laboratory test. That is the fluid in the lungs. Bronchoscopy, already I told you that. Okay. Needle aspiration. Okay. And okay, sometimes mediastinum. Okay, they will check the mediastinum. They will mediastinotomy. Some sample of mediastinum will collect, or coastal region or ribs. Okay. So this is the advanced technique which is performed by the surgeons, not the, and to know the cancer of the ribs, okay, or else uh, any deficiency, any problem in the lips, they will collect from the second rib, third, fourth, or fifth ribs. Okay. It is nothing but biopsy. Okay. So these are the simple and important things we have to remember. Okay. Now we'll come to the other parts. Okay. So basically, now we have to start about diseases. So let's highlight you the important diseases, what we are going to study. Basically, the first disease, which is very, very important, we are going to, we see in the regular things, that is asthma. Okay. We will talk about asthma. Okay, this is the first disease we are going to talk about in detail. And second is pneumonitis, okay, or pulmonary infiltrates, or eosinophilia, increase of eosinophilia, okay, pneumonitis. Third is pneumonia, okay. And fourth one is, we'll talk about bronchitis and lung abscess. And lung abscess. Fifth one is cystic fibrosis. And sixth one is very important. This is also COPD. And thrombosis, DVT in respiratory system. Seventh one, DVT in respiratory system. And eighth one is sleep apnea. Okay. And ninth one is lung transplantation. How they do lung transplantation? What are the procedure? We will talk in some important things we'll discuss. Okay. So these are the 8 to 9 diseases. We'll talk in detail. Mostly, uh, we'll have the 4 to 5 diseases which is common in our clinic. That is asthma. Second is COPD, chronic obstructive pulmonary disease. Next, third one is pneumonia, and fourth one is bronchitis. Okay, these are the 4 important diseases which comes in our clinic in regular basis. Okay, other like lung abscess or nothing but lung cancer. We'll talk about lung cancer in oncology. Okay, here not. We'll discuss separately oncology in detail. Okay, here only talk about the general diseases. Okay, so let's start with asthma. Basically, what is asthma? It is one important question. Asthma is nothing but it is a syndrome. but it is called syndrome. Syndrome is having multiple things initiated. Okay, like we'll discuss here. Okay, and what happened? Like the patient have breathing difficulty, respiratory distress. Okay, all the and dyspnea. Okay, and low flow of oxygen, unable to talk. Sometimes the patient fell into unconscious level, coma. So all these things, there is no only particularly one respiratory system symptoms. He have multiple symptoms from the rest, all the systems. So there's the reason we are calling it as syndrome. Okay, in that what will happen? The airflow obstruction will happen. What happens? Airflow obstruction. First thing. Okay. So this is airflow obstruction. It is due to the inflammation. Sometimes, what are the airflow in our lungs? We have trachea, we have bronchi, bronchioles, okay, primary bronchi, secondary bronchi, tertiary bronchi. Okay. The airflow from that area, the air is coming into the alveoli region. Okay, there is obstruction or any inflammation. We okay. So, but it is not due to the uh, any pathological condition. It is due to the trigger of any substance. This is important. Okay. This is very, very important. Followed by patient have dyspnea, breathing difficulty due to this airflow obstruction. Okay. And second thing is that it is not irreversible. It is reversible. You can treat asthma. The patient will become normal after treatment. Okay, so that's the reason we will call, sometimes this is called syndrome. Okay, so I will, uh, what are the causes? So this is, I think, understood about asthma, where it happens. Okay, how it is happening, reason we will talk. First is we have endogenic factors. What is endogenic factors? Means internally, what are the reasons? Not pathologically. Pathological means it is a bacteria, virus, any pathogen is attacking, and then after you have the symptoms. But here we have endogenously, internal factors. What is genetically? One is genetically. Genetical consideration. What we will call genetical consideration means family history. What is family history? Next is airway hypersensitivity, means the lungs, the airways, bronchioles, whatever is there, they don't have proper, or they have weakness, or some in common terms we will talk about. They are not built up. Their quality is not up to the mark. So that's the reason any simple thing is going to irritate them, and they will constrict. The airflow will constrict and they will blockage into the airflow. Okay. So airway hypersensitivity, what we will call hypersensitivity airway. Second cause endogenous factor internally. Third one is gender, mostly female or male, both will have, but mostly here we can assume that uh, female have more common than male. Okay. And obesity, fourth one. Obesity also cause asthma. So these are very important things. Fifth one is any viral infection, any viral infection happened in the earlier stage in the childhood. Due to that, the hypersensitivity happen. Okay, not this is not the actual cause. It is the beginning of asthma. So these are the endogenous factors. Understand here till next we have environmental factors. Means the obstruction of the airways is due to the environment. Okay. Environmental factors. That is the reason we call environmental factors like indoor allergens, outdoor allergens, any sanitizers, smoking, any infections here. Infections of the respiratory system triggers asthma. Okay. What are the allergens? Different types of allergens. Let's see the image. There are more than this, but here we have the top five indoor allergens. You can see that a cat, the dust, okay, okay, molds, okay, storage things in the house. So these are the things you will get the allergen, the product which will enter into the nose to the nose. It will enter into the airways, bronchi, bronchiole. Okay, it will trigger the obstruction to the asthma. And we have environmental allergens, or these are called outdoor allergens. What we will call outdoor allergens. You can see pollen, mold, cockroaches, pets, grass, house dust. So these are the outdoor allergens. We know the smoking, any sanitizers. Like sometimes some persons have allergic to and allergic to sprays also or perfume also. They will that will trigger to them to cause asthma. Okay. And sometimes some triggers also. So what are the triggers? Let's see that. Exercise. Okay. Exercise is also called sometimes cause hyperventilation, means need of excessive amount of oxygen in the body, which leads to asthmatic attack, or sometimes cold air. Okay. Exercise leads to hyperventilation. And second one is cold air. Cold air also is the reason for the attack of asthma. And gases, irritating gases, like while going outside, we have the different vehicles. Some vehicles will release carbon monoxide, sulfur dioxide. Okay. This will cause the asthmatic attack, carbon monoxide or sulfur dioxide. Fourth one is drugs, some medications. In the allopathy also, like we have beta blockers for the hypertension, aspirin, okay, and sometimes stress, okay. Stress also causes asthma. And irritants also, I told you that, like spray, okay, perfume, any type of sprays which leads to asthmatic attack. Okay. So here we have to maintain hygienic for this patient. this type of asthmatic attack patient, they have to use mask to protect from all these things, and they have to protect from all these things, outdoor allergens, indoor allergens, sanitizer, smoking, environmental places, infections, okay, or exercise. You have to do stepwise exercises, not vigorously. They have to do they have to do simple and basic exercises, and they have to give pause for some time. Okay, rest. They have to take the rest. Proper ventilation. Air have to become okay to become easily. They will get oxygen and carbon dioxide release early, and whatever drugs which are causing asthmatic attack, they have to avoid that. They have to consult the doctor about the drugs. Stress, to they have to release the stress, and whatever irritants like sprays, perfumes, they have to avoid. So these are the causes: endogenous factors, environmental factors, triggers. Okay, we have I already told you that here in the asthmatic attack, there is a not direct attack of pathogens. But if the as any pathogen attacked, later stages asthma will occur. This thing is seen in some patients. Why this happening? Because we have the inflammatory process which leads to asthmatic attack after attacking of pathogen in the respiratory system. Okay, so this is the thing we have to remember. Like, what are the things which cause inflammation in our body? Like macrophages in the body, in the lungs, we have macrophages, dendritic cells, okay, eosinophils. So in the asthma, we have blood test also. In that, whatever allergens are there, we will check that. They will take the sample, and we will more than 8 to 9 things which are there. They will check allergic profile. What we have allergic profile, it will cost. It is very costly, more than 5,000. Some places 8,000, depending upon the lab. Okay. So eosinophils. Okay. Next, we have neutrophils. This is also due to the inflammation. Okay. Then later stage, the asthmatic attack will happen. T lymphocytes, we have to remember this. Okay. T lymphocytes and structural cells. So these are the inflammation due to the infection. These things are increased in our respiratory system. Due to that, inflammation occurs. After that, the airway obstruction will happen. So this is the step-by-step procedure. Okay. So already we talked about in detail all these things. So what is the diagnosis? First is uh, clinical diagnosis. Clinical diagnosis is very important. Whenever a patient comes to your clinic, you have to diagnosis. You have to do the diagnosis in your clinic only. Okay. After that, you have to confirm the direct diagnosis. You need some tests. So what are the clinical features the patient has? The patient will have wheezing sound. Already I told you that wheezing sound. When you check with the stethoscope, wheezing sound is the first sign, along with dyspnea, breathing difficulty, and cough. In the customer also, the patient have cough. Sometimes continuous cough, sometimes not non-spontaneous. Okay. And in the night, the symptoms will worse. These symptoms will increase in the night period. So most of the patient will sleep in the morning and awake in the night because of this worsening symptoms. Okay. And mucus production will increase. What happened in the this thing we have the mucus production will increase. So these are the things we have to remember. And the patient will have fear, shivering sometime, and they have fear. Okay. And the most important things, the patient like this, the inspiratory signs are less, expiratory signs are high. Like that, the expiration is more, inspiration is less. And you can absorb the symptoms. The all the muscles are involved, respiratory muscles are involved, particularly in the uh, children. Okay. So these are the some signs, symptoms, clinical observation. You need to do like wheezing sound, dyspnea, cough, and the patient inspiration is more than expiration. This is very important sign, particularly in the children, and they have mucus, they will expose mucus, and some children will have non-productive cough, less amount of mucus, but cough is more, and cough, dyspnea, wheezing sound. Sometimes you doesn't need a stethoscope to check the wheezing sound. You can hear by sitting in front of you because of the large bronchioles are constricted. Airflow blockage happen. So you will able to hear with your ears also. Okay. Some diagnosis also we will do with the laboratory test. Like we have, I already told you that allergic test, allergic profile. This is very important to know the what are the allergens which is causing this. Okay. And we have IgE test. IgE test is very important. Serum IgE. IgE. Okay. And pulmonary function test or lung function test. LFT, PFT or PFT. Okay. Next we have skin test. Already I told you that they will prick the skin, whatever allergen is there, they will keep on that area. So any if there is the product is irritating the area, so patient will have the side effect. Means the patient is the thing we have to protect from that things. Okay. So this is very important to us. So this is all about asthma. We will talk about treatment part tomorrow. Okay, in detail. If any doubts, kindly ask.